Lawrence Memorial Hospital now brings you better health.
So exercise-induced asthma, actually a better term for that is exercise-induced bronchospasm or bronchoconstriction. So when we look at exercise-induced bronchospasm, we're looking for a really specific set of symptoms. And those are patients that typically notice that they get short of breath, chest tightness, or cough, usually 5 to 15 minutes after exercise. A good example is a 20-year-old college student who goes out for a 2-mile jog, and he does very well with no symptoms during that jog, but 5 to 15 minutes after, he again notices chest tightness, cough, shortness of breath. Wheezing can come and go, it's not always present, and usually the symptoms get better and go away after an hour. So that's more definition for exercise-induced bronchospasm. Asthma in general, patients tend to have these symptoms that occur certain times of the day. Usually it's worse more so at night, early morning hours. Certain illnesses, allergies, viral infections, sometimes exercise can bring on the symptoms, but it occurs more throughout the day and not specifically always just with exercise. If I had a patient that was concerned that they could have these symptoms, I'd really ask them to pay close attention to when the symptoms are occurring. Again, if they're occurring at the beginning of exercise or when the exercise is complete. I'd also ask them to look at symptoms that could suggest regular asthma with symptoms at other times of the day or in the early morning hours. If they had classic symptoms, I would want all the patients to know that this is very treatable disease and that we can keep them functional and active and working out, and the therapy is really easy to do, so that they should talk about it either with us or their primary care physician.